Every day, millions of people swallow a small white pill without thinking twice. A pill they believe is harmless. A pill that promises fast, easy relief. But behind that promise lies a medicine powerful enough to calm the body, influence the mind, weaken your energy, and if misused, slowly take control of your daily life. This pill is Tramadol. From employees dealing with back pain to mothers struggling with headaches to patients recovering after surgery, people take Tramadol believing it is just another painkiller. But the shocking truth is that Tramadol affects the body in 7 major ways, and most people have absolutely no idea how deep those effects go. In this video, we're breaking it all down in a simple, honest way, no complicated medical terms, no confusing science. Just clear, real explanations of what Tramadol truly does inside your body. If you are currently taking Tramadol, planning to take it, or know someone who uses it, then this video is one you cannot skip. Watch until the end, because understanding this medicine might protect your safety, your mood, and even your long-term health. So let's begin the real story behind Tramadol. Tramadol is a prescription medicine used to treat moderate to moderately severe pain. It is commonly recommended for back pain, nerve pain, dental procedures, muscle injuries, accidents, and even long-term conditions like arthritis. Unlike simple painkillers such as paracetamol or ibuprofen, Tramadol belongs to a group called opioid analgesics. This means it works on the same pain receptors in the brain as stronger opioids, but is considered milder. However, mild does not mean risk-free. Tramadol does not reduce swelling or inflammation the way typical pain medicines do. Instead, it works mainly inside the brain and spinal cord, changing the way your body feels pain rather than removing the cause of it. Doctors often prescribe Tramadol because it works quickly, provides relief when other painkillers fail, and is available in various forms for flexible use. But since Tramadol directly affects the brain's chemistry, it can also influence mood, calmness, energy levels, and even emotional balance. This is why some people feel relaxed after taking it, while others experience dizziness or nausea. Understanding what Tramadol is helps you understand why its effects can be both helpful and potentially harmful. Once you swallow a Tramadol pill, your body immediately begins breaking it down inside the liver. Within about 30 to 60 minutes, it enters the bloodstream and travels straight to the brain. Here's the simplest way to understand what it does next. First, Tramadol blocks pain signals. Your brain has opioid receptors, tiny locks that control how strongly you feel pain. Tramadol acts like a key that turns those locks off, reducing the intensity of any pain message coming from your body. Second, Tramadol increases serotonin and norepinephrine, 2 chemicals that influence your mood, sleep, stress levels, and emotional balance. This is why some people feel calmer, happier, or lightly euphoric after taking the medicine. Third, Tramadol slows down parts of the central nervous system. This is the reason many people feel sleepy, slow, or mentally foggy after taking it. Finally, Tramadol changes your brain's perception of discomfort. Even if the pain is still there, your mind becomes more tolerant of it. All these combined effects make Tramadol unique. It doesn't fix the source of pain, but it changes the way your brain responds to it. Tramadol can be extremely beneficial when used correctly and under medical supervision. One of its biggest advantages is strong and reliable pain relief. People suffering from back injuries, nerve pain, muscle strains, migraines, bone pain, or post-surgery discomfort often experience noticeable improvement. For many patients, Tramadol works when regular painkillers like ibuprofen or paracetamol fail to provide relief. Another major benefit is improved sleep. Pain often makes it difficult for patients to rest, but Tramadol reduces discomfort enough to help them sleep through the night. For individuals dealing with long-term pain, this can greatly improve quality of life. Some users also feel emotionally calm or relaxed due to its influence on serotonin, helping reduce anxiety connected to pain. Tramadol also comes in many forms: instant-release tablets, injections, drops, or extended-release capsules that offer 12 to 24 hours of steady relief. This makes it useful for both short-term injuries and ongoing pain conditions. However, even though tramadol offers strong benefits, it must always be taken responsibly. Because it affects the brain, its positive effects can shift into negative ones if the medicine is misused or taken without proper knowledge. Tramadol has several important side effects, and understanding them is essential for safe use. One of the most common effects is drowsiness. Many users feel sleepy, mentally slow, or unable to concentrate because the medicine slows down parts of the nervous system. Dizziness is another frequent complaint. Some people feel the room spinning or their body feeling weak shortly after taking a dose. Stomach-related issues are also common. Nausea, vomiting, and constipation appear because tramadol affects digestion and slows down gut movement. Mood changes can occur as well, since the medicine influences serotonin levels. Some users may experience irritability, sadness, anxiety, or sudden mood swings. Another major concern is dependence. When taken for long periods, the brain may begin to rely on the medicine, making it difficult to stop suddenly. Withdrawal symptoms may appear if the dose is stopped abruptly. Additionally, mixing tramadol with alcohol, sleeping pills, antidepressants, or other opioids can be extremely dangerous. These combinations can lead to breathing problems, seizures, or even coma. Though many side effects are mild and temporary, some can be serious. This is why users must always pay attention to how their body reacts while taking tramadol. Doctors generally agree on one thing: tramadol is safe only when used exactly as directed. The first and most important rule is never to exceed the prescribed dose. Many severe reactions happen when people think one extra pill won't hurt. The second rule is avoiding alcohol or any sedative medication while taking tramadol. These combinations increase the risk of dangerous side effects, especially breathing problems. Doctors also recommend never stopping tramadol suddenly, especially if you have been taking it for weeks or months. The body can experience withdrawal-like symptoms: restlessness, sweating, irritability, or trouble sleeping. A slow reduction plan, guided by a doctor, is always safer. Taking tramadol with food can reduce nausea and stomach discomfort. It's also crucial to inform your doctor if you're taking antidepressants, because combining them can produce a dangerous condition known as serotonin syndrome. For long-term pain management, doctors often prefer using tramadol only under continuous supervision. Finally, if you experience severe dizziness, chest tightness, confusion, or trouble breathing, you should seek medical attention immediately. These can be early warning signs that the medicine isn't suitable for your body. Tramadol is not a magic pill, but it's also not a dangerous monster. It is a powerful tool, one that can bring comfort, help you sleep, reduce suffering, and support your recovery. But like any tool that works on the brain, it demands respect and responsible use. When taken properly, tramadol can greatly improve daily life. But when misused or mixed with the wrong substances, it can create serious risks. If you're using tramadol, always follow your doctor's guidance closely. Take it in the right dose, at the right time, and never mix it with alcohol or other sedating medicines. Listen to your body, watch for side effects, and always report anything unusual to a healthcare professional. Pain can push people to make quick decisions, but the safest decision is the informed one. If this video helped you understand tramadol better, don't forget to like the video, subscribe for more helpful explanations, and share this video with someone who might benefit from it. Your support helps us create more simple, clear, and life-changing health content. Thank you for watching, and take care of your health.